Good morning, ma'am. Today I will perform the applying topical medication on patient. First thing to do is gather all the equipment, check medication order against the original physician order according to the agency policy, then clarify the inconsistency, check the patient chart for allergy. Then note the actions, special nursing consideration, safe dose, ranges, purpose of administration, adverse effect of the medication to be administered. Consider the appropriateness of the medication for the patient. Then perform hand hygiene. Then prepare medication for one patient at a time. Then read the MAR and select the proper medication from patient medication drawer or unit stock. Then compare the label with the MAR. Then check for expiration dates and perform calculation if necessary. Then when all medication for one have been prepared, recheck the label with the MAR before taking them to the patient and return the medication stock to patient's drawer. Then transport the medication to the patient bedside carefully and keep the medication in sight at all times. Then ensure that the patient received the medication at the correct time. Then identify the patient. Usually, the patient should be identified using the two methods. Compare information with the MAR. Check the name or the patient identification card. Ma'am, check ko lang po kung yung identity. Okay. Then if the patient cannot identify him or her, verify the patient identification to the significant other. Ma'am, ask ko lang po kung ano pong pangalan ng patient, ma'am.
Kitaiza.
Okay po, thank you po. Then complete necessary assessment before administering medication. Check allergy bracelet or ask the patient about the allergy. Then explain the purpose and action of each medication to the patient. Ma'am, ask ko lang po kung meron po ba siyang allergy sa food or sa medicine?
Wala naman po.
Okay po, thank you po. Then perform hand hygiene and put on gloves. Next to do is wash, rinse, and dry the affected area with water and clean gauze. Ma'am, pa-assist naman po ako para mailagay ko po itong Ma'am, pa-assist po. Assist lang po, ma'am. Change gloves and perform hand hygiene in between. Place required amount of medication using a cotton tip applicator. Note the cotton tip applicator is sterile and it is for single use. Let the patient know that the initial application may feel cold. Apply medication using one stroke and observe the inner to outer application. Next things to do is observe signs of irritation or redness. Then perform hand hygiene. First thing to do is remove the gloves. Then document the procedure in patient chart. That's all.